For men with prostate cancer, getting rid of the cancer is obviously the top concern, but the fear of becoming incontinent is also a major consideration. Male urinary incontinence is caused by a damaged urinary sphincter, the circular muscle that controls the flow of urine out of the bladder. When damaged, as may occur during any prostate cancer treatment, the muscle cannot squeeze and close off the urethra entirely. This causes urine to leak. The incontinence rate following prostate cancer surgery ranges from 1 to 31%. Many men suffer in silence for years, thankful that they have survived the cancer, but they choose to restrict their activities and change their lifestyle out of a fear of embarrassment from odor, wetness, and the discomfort of disposable pads. Feelings of isolation, anger, and depression are common, but it doesn't have to be that way.
In dealing with incontinence, I had to change my lifestyle. I changed my wardrobe. I wore only dark pants because if I had an accident, I didn't want anybody to know.
I didn't even want to golf anymore. I'd go golf with my buddies and I was afraid that if I'd swing that club, I'd leak a little bit. I didn't play with my grandchildren like I normally would.
The most common type of incontinence following prostate cancer surgery is called stress urinary incontinence, or SUI. When the urinary muscle or nerves are damaged but still have some function, SUI happens when you leak urine during activities such as sneezing, coughing, or other exercise movements like bending, lifting, swinging a golf club, or jogging. In cases where the urinary sphincter muscle is completely non-functional, the result is continuous leakage of urine with no control. While every man's situation is different, many find they regain continence within 6 to 12 months after prostate cancer surgery. If the symptoms persist beyond that time, you should discuss your situation with your doctor. The good news is that there are more treatment options than ever before, and nearly every man can be helped to regain bladder control. There are a number of ways to deal with incontinence, ranging from ongoing management to permanent surgical solutions.
I tried the biofeedback, finally resorted to a Cunningham clamp, but I was not just leaking, I was draining. I was using more than 15 pads a day and 1 or 2 diapers a day.
To deal with my serious incontinence, I tried many different things. I tried a condom catheter, that didn't work. I tried having regular pads, that didn't work. And I tried a clamp, a penile clamp. And the penile clamp is extremely frustrating because certain times it works very well, but sometimes it really hurt.
Surgical options include a male sling designed to support and boost the muscles surrounding the urethra, and an artificial urinary sphincter, which mimics the function of a normal, healthy muscular sphincter with the squeezing. Let's talk a little bit more about those treatments, which can provide a permanent solution to the problem of incontinence. For men with mild to moderate stress urinary incontinence, those wearing less than 3 pads per day, the Advance XP male sling system may be the most appropriate treatment.
I talked to my urologist about what steps I could take to eliminate this problem, and there was a few that he mentioned, and I decided to go with the Advance sling.
The sling supports and boosts the urethra muscles, restoring normal bladder control. There's nothing to operate, and it's completely inside the body. The Advance XP male sling is a minimally invasive outpatient procedure that can be carried out under spinal or general anesthesia. During the procedure, a small sling made of synthetic mesh is placed inside the body through small pinhole incisions. Many patients are continent immediately following the procedure and can resume normal, non-strenuous activities shortly afterwards. The Advance XP male sling is not for everyone. Treatment results may vary depending on your own medical condition. Talk to your doctor to discuss the risks and benefits of this device and your specific treatment options. The Advance XP sling is only available from your doctor.
I did, and the best thing I've done. So I've got my life back. It's great because a lot of times before I had the advanced male sling, my youngest son would sit on my lap and he would just hit that right place and it would be like, okay, here, I gotta run to the restroom. And that, that was very disturbing and trying. And frustrating and depressing that I couldn't do any of that, you know, and now I can. Now I can do it all.
Life is as good as probably as it was 25 years ago.
You know, since Gary's had his surgery, he feels like he's gotten his manhood back. I got my husband back full, and we're both very happy.
I haven't had to wear a pad since. It's great. I feel like like a new man. And my friends and family can tell. They've shared that. They've said you carry yourself in a more positive way, and they can tell I'm happy.
For more severe incontinence, or those whose symptoms are not treatable by other methods, your doctor may recommend a device known as the AMS 800 artificial urinary sphincter to provide a simple, discreet method of permanent urinary control. Since 1972, this has been the gold standard worldwide for treating severe incontinence. It effectively gives most men the ability to achieve continence, and published clinical data shows long-term effective results. Patient studies have shown that 90% report satisfaction with the AMS 800 and 92% would have the system placed again.
I heard about the artificial sphincter from talking to my doctor, and I was telling him about the pads and so forth, and I also used the external catheter and everything, and I was getting tired of it, and he told me, well, the artificial sphincter would help cure some of those problems.
And then finally, what the doctor referred to as the gold standard, he said this is the AMS 800, and it's the sphincter, it's an artificial sphincter muscle, and he showed how that worked.
Placed completely inside the body, the artificial urinary sphincter mimics the healthy sphincter, keeping the urethra closed until you want to urinate. The device consists of a connected system of a pump implanted in the scrotum, a cuff surrounding the urethra, and a balloon reservoir implanted in the abdomen. You control urination by squeezing and releasing the pump, which moves fluid out of the cuff, which is compressing the urethra, and back into the reservoir. Because the empty cuff is no longer closing the urethra, urine can now flow out of the bladder. After you've emptied your bladder, the fluid automatically returns from the reservoir to the cuff, squeezing the urethra again closed. Implanting the AMS 800 typically requires about an hour of surgery and can be performed on an outpatient basis or within a 23-hour stay. The AMS 800 is not for everyone. Treatment results may vary depending on your own medical condition. Talk to your surgeon to discuss the risks and benefits of this important device and your own specific treatment options. The AMS 800 is only available from your urologist.
If I knew now, 5 years ago, I would have done it then.
I remember going to get it activated after 6 weeks, and it was amazing. I had no leakage, absolutely none. So it was just wonderful. The artificial sphincter has changed my life dramatically. I could put the diapers away and never have to use them again. It was just great.
Joy, elation, excitement, that as if someone had given me a new start in life. And it was goodbye pads, goodbye diapers, goodbye plastic. You know, I'm back.
In summary, stress urinary incontinence is a common yet bothersome problem, but nearly every man can be successfully treated. The Advance XP male sling system, or the AMS 800 urinary control system, may offer dependable, long-term solutions that you've been looking for to help you regain your control and confidence and restore your quality of life.
You do not have to live like this. You don't have to live with incontinence. You know, there are options out there for you. So do it.